Good day, dear friends. With you is Natalia on the channel Dr. Savkina, where I share my personal experience and answer your questions. Each of us needs to know our blood type. Why, you might ask? I'll answer. Firstly, none of us are scared of unforeseen situations when information about the blood group can save our life. Moreover, knowing your blood group, you can determine the predisposition to the development of certain diseases. Thus, as far as possible, conduct their primary prevention. As they say, if I knew where I would fall, I would have put some straw there. I'll start perhaps with the fact that in determining the blood group, the decisive role is played by erythrocyte. On the surface of each erythrocyte, there are specific proteins, antigens A and B, which interact with our immune system, thereby determining the predisposition to the development of one or another disease. Each of us can have these antigens present in different combinations. This is how blood groups are distinguished. On the question of how many blood groups there are in total, many of us, without thinking, would answer. However, some individuals have unique characteristics, thanks to which their non-standard blood does not fall under the signs of this or that blood group. Most of us have first group blood flowing in our veins. The second position is occupied by the owners of the second group. Every 10th of us has a third blood group. But the fourth blood group is characteristic only for 4% of the entire population of the globe. As for the Rh factor, about 70% of the population has Rh positive blood. So, a certain set of erythrocytes can tell a lot about each of us. And first and foremost, they can indicate a predisposition to certain types of diseases. How can we use this data? First and foremost, to identify weak spots in the body in time and pay proper attention to them. As multi-year practice shows, people with the first blood type are resilient individuals with strong health. However, some of them are prone to developing stomach ulcers, intestinal inflammation, gallbladder diseases, and various types of allergic reactions, up to bronchial asthma. Women with this blood type, more often than others, encounter problems in the reproductive sphere. People with the first blood group should make friends with a gastroenterologist, as many of them have specific bacteria living in the gastrointestinal tract capable of destroying the mucous membrane. Hence the problems with the gastrointestinal tract. On the other hand, it is established that people with the first blood group very rarely have serious heart and vascular diseases. By the way, mosquitoes prefer people with the first blood group, so they need to protect themselves from bloodsuckers. People with the second blood group, according to scientists, have major problems with immunity. That's why they often suffer from respiratory diseases and are prone to allergies. It's interesting that people with the second blood group are most often subjected to stress. They have a higher level of adrenaline and cortisol, as well as excessive blood clotting. Cardiovascular diseases and chronic fatigue syndrome become their unfortunate companions in life. Therefore, in order to avoid many health problems, people with the second blood group need to rest more, try to avoid various kinds of stress, devote time to relaxing physical activities, and primarily to yoga. Most of the long-lived people on our planet are individuals with the third blood group. They are quite resilient, not prone to various kinds of viral diseases and the development of oncology, with the exception of intestinal cancer. A real threat to the health of individuals with the third blood group can be poor blood coagulation. They quite often have problems with the urinary bladder and diseases of the ear, throat, and nose. People with the third blood group would do well to befriend a neurologist, as radiculitis often becomes a frequent companion in life for many of them, and Parkinson's disease in older age. The fourth blood group is the rarest. Its representatives often encounter various types of infections and prostatitis more than others. So to speak, their immunity suffers. People with type 4 negative blood are more likely than others to have congenital heart defects and blood diseases, primarily anemia. In addition, they often suffer from high blood pressure and are prone to strokes.
In old age, people with the fourth blood group often experience weakness more than others.
To prevent potential disorders, representatives of the fourth blood group need to constantly monitor their cholesterol levels, especially its atherogenic fractions and blood sugar, and also maintain target levels of arterial pressure. Logical games for the development of memory and thinking will also be far from superfluous. By the way, regarding the problem of the new coronavirus infection, it should be noted that you can judge how hard the disease will be to endure based on blood groups. Moreover, unfortunately, those with the second blood group have the highest risk of contracting the coronavirus. On the other hand, people with the first blood group are much less likely to catch the coronavirus, suffer milder symptoms, and are less likely to die. You were with Dr. Savkina. Subscribe to my channel and stay healthy.